I hope everybody is able to see my screen. Nice to be here again. Nice to see some familiar faces in the room. Um, we apologize again for starting a little bit behind time. I like to stay on schedule, so I'll try to ensure that we wrap up on the hour. Today we'll be talking about strengthening health systems to combat antimicrobial resistance, and I'll be focusing on policy innovations and strategic actions. So to start with, the objective of today's session is to explore how policy innovations and strategic actions can strengthen health systems in effectively combating AMR. We are going to examine forward-thinking policies that have made impact in AMR control, such as the National Action Plan that's used in Nigeria, the Global One Health strategies. We would also identify policy gaps. We'll discuss the weak enforcement of antimicrobial regulations, limited surveillance. We would also briefly touch on healthcare coordination and how that fragmentation can impact AMR strategies. We would also look at the best practices that are used for multi-sectoral approaches that integrate One Health approach towards tackling AMR issues. And for our learning objectives for today, we hope that at the end of the session, you would have gained some awareness on policy innovations that are being used globally and locally to tackle AMR. We hope that you would be equipped with actionable strategies to enhance stewardship and infection prevention practices within your area of influence and within your health systems locally. And we'll also ensure that you understand the importance of having an effective multi-sectoral collaboration, because I personally, and I think everybody who is working within the space of AMR believes that that's a cornerstone for having a sustainable intervention to address AMR. And with all of these in mind, we would move ahead with the key parts of the lecture. So I think that one of the first things that I would like to state when it comes to AMR, I think that this is something that you've heard so many times from Taiwo and from some of the other wonderful speakers that we've had so far in this program, is that AMR is not a medical issue per se. It's not just about the microbes that are going to infect people and the microbes that we cannot fight, but it's in general as a health systems challenge. We have to think of it in a holistic way. We already know that there is a requirement, there is a need for a multi-sectoral approach towards addressing this issue, particularly when we look at the One Health framework that looks at human, animal, and environmental. We know that all of these different systems are managed separately in most health systems, in most countries. In Nigeria, at least I can speak for Nigeria with full confidence, all of these are managed in silos, in different structures. And what frameworks like One Health aim to do is to bring that together. And that's something that we always have to consider when we want to address the issue of AMR, that without having a strong and resilient health system that is working in harmony across all the different sectors, that brings all of that together, it limits our ability to prevent, to detect, and even to respond to AMR. Mute yourself if you want. Thank you. Okay, and so with that in mind, we'll go ahead and talk about the roles of the key roles that the health system can play in AMR prevention. And again, just to reiterate, as we go into the discussions in this lecture, I know that some things might seem repetitive, but it's because we want to take a systems thinking approach towards how we address this. And you would find out that what happens is that everything within the health system tends to be connected. And so it revolves around each other. And that's why we are taking that approach in looking at it in a multi-sectoral way. Now, the first role that a health system would play in AMR prevention is, I think that this is probably one of the most important aspects, particularly as researchers, because this is how we are able to even identify that there are problems. And that would be in having an effective infection prevention and control system within the health system, having an effective IPC structure, IPC mechanisms within the health system. We can say that a strong health system would ensure that the implementation of IPC programs in healthcare facilities across different levels. You have your tertiary, your general hospitals, your secondary health facilities, and even down to the primary healthcare clinics, that all of these, the health system ensures that they are able to implement IPC programs across all of these levels. One thing that is common in many low and middle income countries like Nigeria is that we have inadequate IPC, and that tends to, as we know, lead to the spread of more drug-resistant infections. An example would be in looking at overcrowding in hospitals, or the limited availability of isolation facilities that we see in many of our healthcare settings, and how all of these can contribute towards increasing healthcare-associated infections that then fuel AMR further. So that is a role that having a strong healthcare system can help in curtailing and help in managing and ensuring that IPC programs are effective and are efficient in the way that they are implemented in health facilities. Another key role that a resilient health system can play in preventing AMR would be in the surveillance and data systems, or you can say the surveillance and monitoring systems as well. Any resilient health system would provide a robust AMR surveillance, as this can enable timely detection of resistance patterns and outbreaks. One thing that we know is that we want to be able to identify the problem when it's really small at its first occurrence before it becomes an epidemic. We want to be able to curtail and to mitigate the challenges at the first instance that they appear. And that is one thing that the surveillance system can help us to do for early detection of resistance patterns in outbreaks and that are related to antimicrobial resistance. And we know that one of the challenges that we might have in countries and places where the health system is not necessarily as robust as it should be is that you might have issues around weak laboratory systems that might hinder data collection and in turn limit evidence-based decision making. Again, I'll give an example of Nigeria. While in more recent times with the COVID outbreak, with more recent outbreaks, cholera and such, we are having a stronger presence of laboratory systems, but still there's still a lot of reliance on the national reference laboratories in Nigeria. And I think at this time we have the laboratory in Abuja, in Lagos, and I think there's one more in, I forget the states. But when you think about that and the capacity to be able to keep up with disease outbreaks, to be able to keep up with resistant drug-resistant microbes and having the laboratory capacity, so that's something that's quite important. You consider the time it takes to transport samples from, an example is the difficulty in transporting samples from, say, the Northeast all the way down to Abuja to get it to the National Reference Lab for testing. It might not seem like a big time, but the 2 days, 3 days, 1 week, all of that can make a very huge difference. So this is another key part where having a resilient, very strong, resilient health system comes into play. Another aspect would be in looking at stewardship programs, antimicrobial stewardship programs, such as this one. This is one of such programs. In a resilient healthcare system, programs like this are built into the normal system. They are institutionalized in the way that at every level, it is very common to see healthcare workers, to see community health workers, to see veterinary service workers engaged in antimicrobial stewardship programs. Their capacity is continuously being built to ensure that they are staying up to date with what needs to be done, with the policies that are being rolled out across globally and locally, and that they have the capacity, they have the right tools to continue to manage AMR? Thank you, Christina. Yes, the lab is in Oyo State. Thank you for that. And then we look at having equitable access to healthcare services in Nigeria. That is probably one of the areas that we have one of the biggest issues, because we know that when people do not have access to equitable to healthcare, to quality healthcare services, well, the next thing that they are likely to do is self-medicate. And this has been one of the biggest issues, or one of the biggest talking points when it comes to how we want to address AMR, In a resilient system, we ensure that there's access to diagnostics and quality medicines, that people are able to spot a symptom, get tested immediately. Once you get tested, you can easily tell a person that, oh, you have a viral infection rather than a bacterial infection, and so using an antibiotic in the first place is kind of pointless. So those are the sort of things that having a quality healthcare system can help to mitigate and reduce the incidences of self-medication, which is a major contributor to AMR. And the last thing that I would also mention would be in strong governance and leadership. And this is where I believe that policy comes into play. Overall, the strength of a healthcare system is underpinned by clear policies, strong leadership, and how all of that translates into having accountability mechanisms for those policies. And one thing that I'm going to reiterate in the other parts of this discussion is in looking at how policies work and why having strong governance and leadership is so paramount to the success of a policy. Again, it's very easy to set a policy. Anybody can set a policy. In fact, I have a policy in my household: no footwear inside. But could you imagine a scenario where I have that policy, I have guests coming to my house, but maybe it's raining and I have no space for them to put their shoes? The likelihood that my guests are going to want to take off their shoes while leaving the shoes outside to the elements it's very unlikely. In fact, if I went to someone's house and they tried to make me leave my shoe outside, I'll probably turn around and go back home. So so when we make policy and when policies are put in place, we also have to consider the capacity of the people who are going to implement the policy, and also the structures and the systems that are in place to ensure that the policies are being implemented, to ensure that the policies can be implemented. And again, that is a role that a resilient health system can play in having that. A good example would be in looking at the One Health governance approach that the United States uses in their own national action plan, and how they have a strong coordination. They're able to have a very strong coordination. And that strong coordination serves as a platform for implementing the policies in a very, very effective and efficient way. And we'll look at that when we get to some later parts of the webinar. Okay. Now looking at the core components of the policy frameworks for effective AMR response. And I really like that Christina has given us that segue to see that, in fact, our major problem is policy implementation in Nigeria. Again, it's very, very easy to set a policy, to write a policy, to adapt a policy. One thing that I can point out is that when it comes to, so for example, when they do IHR, that's the International Health Regulations, they do routine evaluations to ensure, to kind of grade countries on where they are in their implementation of IHR. And one of the things that you see in a lot of I'll call it like a checklist, or the tools that are used to evaluate IHR in the country. You have things like ensuring that the policies are in place and all of that. But it's not just about the policy being in place. A country can score fairly good on an IHR evaluation, and we know for a fact that a lot of things that are being scored great are not necessarily being implemented. So some of the core components of a policy framework that can ensure effective AMR responses, of course, to start with, is the One Health approach, because we cannot overemphasize how important it is to take a multi-sectoral approach to tackling this problem. One thing that we know is that the Nigerian National Action Plan for AMR, it does lead, it gives a beautiful um, tra translation per se, or a beautiful adaptation of how you can use the One Health approach and how that translates into having a plan for addressing AMR, because you are integrating both the human aspect, the animal aspect, and the environmental health sectors all together. Although I would also mention that there are challenges that still come up within the Nigerian system, where there are implementation challenges at subnational level. So that is the state and the local government, and even sometimes in the community level, depending on how granular you want to get. There is that fragmented coordination, and so there are issues in all of those areas. But the cornerstone of any effective AMR response would be to take a One Health approach, and is something that is recognized globally and has been shown to be effective at different levels because of the interconnectedness of AMR and how that is represented in the One Health approach. The second thing that I would look at, again, kind of repetitive though, is the surveillance and monitoring system. Any policy framework should obviously have a surveillance and monitoring system, because that is a way to ensure accountability of actions that are taking place, and not just even in ensuring accountability, but in also serving as a means to give us, or to provide the data and the information that we use to make evidence-based decision making. We want to, in settings where resources are limited, one thing that we always strive to do is to take action, or to take the action that results in the most effective, or the biggest impact. We want to be efficient in how we utilize resources, and having a surveillance and monitoring system helps us to do that, in addition to actually helping us to tackle the issue of AMR by having early detection, picking up outbreaks at the right time, reporting them at the right time, and giving us that platform to be able to respond to these outbreaks at the right time, before we begin to have compounded issues with AMR as a result of individuals taking actions by themselves. Another key aspect we'll look at that should be included in the policy framework would be in the regulation of antimicrobial use. I think that, again, this is one of the biggest issues. This is one of the biggest areas that would have in low and middle income countries. I'll give an example. Once upon a time, I was working in a community in Cross River State. One of the things that I observed was that in a lot of the communities where they had little to no access to the primary healthcare centers, there are little or almost no presence of PPMVs within some of those communities. And one thing that I observed was that they had a lot of these older men on bicycles that move around to sell drugs. That's an example of how people obtain drugs at that level. And in having policies and being creative to have policies that, while they tackle the problem or why they try to regulate how antimicrobials are being sold and used, they are careful to not take away a vital resource from a community. And that is something that we as stewards also have to think about, in being creative in how we want to address the issues of regulating antimicrobial use, in being realistic in what our communities need, and at the same time being able to enforce regulations that are going to be effective in finding that balance. Off the top of my head, one example that I can give that does not take away that resource from that community would be to perhaps issue licenses at no cost, licenses that are based on training, on building the capacity of the people who are selling these drugs, giving them the licenses to operate and things like that. I'm sure that those things probably exist already, but we have to moving away from a focus on payments and financial benefits of purchasing licenses, but rather in building their capacity and their understanding of the importance of safe and careful use of antimicrobials when and also in being more cognizant of how they are being sold over the counter and the way that people are utilizing these drugs. The next thing I will talk about would be, as a component of the policy framework, would be having sustainable financing and resource mobilization. This is one area that I think is probably one of the biggest challenges that a lot of low and middle income countries face. An example would be in Nigeria. One of the reports that they have for challenges that have been faced in implementing their national action plan would be things around sustainable funding, limited budgetary allocations. Also similar in a country like Vietnam as well. They have a similar plan, but also they have also shown that the major gap in their health systems implementation of AMR programs would be in sustainable financing and how that can derail policy implementation. And so we would have to ensure that our AMR policy frameworks have components of long-term funding mechanisms, and also in sorry, one second, in having funding mechanisms, in having sustainable funding mechanisms to ensure that the programs are retained. I think that another key way of even addressing this issue is when we talk about institutionalizing AMR efforts in institutionalizing AMR initiatives. We want to ensure that programs are not, they do not exist around the availability of funding per se, but rather that they become part of the systems that exist at different levels of healthcare management or public health management. So I will give an example, which probably also applies to a component of having antimicrobial stewardship programs. An example that I would give would be for example, in a healthcare facility where, or not even a healthcare facility, in the general healthcare education system in Nigeria, we know that one of the requirements for doctors, for nurses, is continuing healthcare programs, continuing medical education, CMEs, that those are a way for them to get points. They attend trainings, they get points and build up the system. Having AMS programs as part of CMEs is a way of institutionalizing antimicrobial programs within the system of education without having attaching additional funding or additional resource mobilization to it, because that is already a requirement that exists in the medical system in Nigeria, for example, and I'm sure it also exists in other places. And so you have AMR programs as part of those systems, things that exist within the system. Another example would be in routine monitoring and evaluation. We know that the different agencies that manage public health and healthcare, they have routine visits to healthcare facilities. For example, the Ministry of Health or the Nigeria CDC, they conduct routine monitoring programs to different healthcare facilities in Nigeria, and having IPC evaluation or AMR evaluations as a component of those routine activities, it becomes institutionalized within the normal systems and the normal processes that a healthcare system would undertake in their activities. So in that long discussion, I've also mentioned IPC and even antimicrobial stewardship programs and how all of those can be reflected in developing policy frameworks for AMR response. In general, and looking at other best practices from other policy frameworks that have been used globally, I think I've mentioned the CARB in the US. I believe that I think that will probably be one of the perfect examples of a comprehensive and well-funded multi-sectoral program that has clear targets and milestones. A similar program would also be Vietnam's NAPCA program. They have highlighted a lot of lessons in improving and scaling up AMS programs and how that has helped to drive the agenda for AMR response within Vietnam. But they've also mentioned challenges that they've had in cross-sectoral collaboration. And these are things that we'll discuss further in the next slide and how we can manage cross-sectoral collaborations for more efficiency. Okay, so moving on to I think this is the meat of the webinar today in discussing what are the specific challenges that one might encounter in developing policy innovations, or what are the specific challenges that we want to develop policy innovations or take strategic actions to address, and what are some of these actions that can be taken. So first of all, we'd look at what the policy gaps in AMR control have been so far, or what's the major ones that have been highlighted by countries like Nigeria, Vietnam, and even the US. So one thing that we know is that despite having national action plans and despite global efforts, despite having well-written policies, having adaptable policies, having the One Health approach that we are also very aware of, there still happens to be several policy caps that continue to undermine AMR response, particularly in low and middle income countries like Nigeria. Some of them are in having like weak enforcement of antimicrobial regulations. Again, we know that over-the-counter sale of antibiotics without prescriptions is very prevalent. That is one area that we believe that a policy can help to tackle. We also have limited One Health coordination. So many countries, like the example I gave with Vietnam, have had reports of having challenges in being able to have effective collaboration between human health, veterinary health, and environmental sectors. So that's also one big challenge that it's experienced in tackling AMR. We also have insufficient surveillance systems. Data collection can be fragmented. There can be a lack of standardization, and it can be hard to track AMR trends. When we think about how data is collected, in Nigeria, for example, we have the tools that are being developed at the national level, but the implementation does not happen at the national level. Implementation happens at the lowest grassroots level. And then we have the state as an intermediary between those two systems. But how do we ensure that that everything is effectively coordinated and that the data is being transmitted from the lowest level to the highest level where decisions are being made, and on that all of this is happening within a time frame that ensures effective response. That's another big challenge that a lot of countries have in having that insufficient surveillance system to be able to address AMR issues. We also have underfunding in AMR programs. Again, a lot of countries have action plans that are built from the policies. They already have that alignment between the policy and the strategic plans, but there still happens to be lack of a dedicated budget just for addressing AMR issues. And then we also have the challenge of workforce shortages and limited training. Again, a lot of the policies are being developed at a national level, but the capacity at the national level is not what is going to implement the policy per se. The policy is going to be implemented at healthcare facility level, at community levels, local government levels. And so there needs to be more capacity building and being able to take the knowledge, being able to translate the policy from that national level at a high level and being able to take it down to a level that is easy to understand, that's easy to implement as well, that people have the right tools, you have the skilled personnel in stewardship across surveillance, in IPC, in laboratories. Again, going back to the example of the laboratory system, we need stronger laboratories at subnational levels to be able to have timely detection of pathogens, of disease outbreaks that might affect the way that we implement our AMR response programs. And then the next thing that we look at is in the economic impact of AMR and funding and overall funding strategies. One thing to keep in mind again is that AMR is not necessarily just clinical, it's not just a health crisis. It can also become an economic threat that has far-reaching consequences for national development, for healthcare systems, for people's livelihoods and people's actual lives. All of this contribute to all of this can come together and build up to becoming a huge economic burden for any country or any system. Um, in general, in looking at at socioeconomic burdens for the individual, you have simple things like increased healthcare costs from staying in the hospital longer because, well, you have been taking the wrong medication or you have been taking the medication that has become resistant to whatever microbe is causing the infection. And so you have people spending more on hospital treatments, more time out of work. You have higher mortality rates, more deaths, more occurrences of deaths, people out of jobs, people out of the workplace, and all of these contribute towards having an economic burden. Other impacts on the healthcare system can be how things like healthcare associated infections might weaken the healthcare system in a low and middle income country like Nigeria or in a place like Nigeria, in different communities in Nigeria where we already know that there is a death of healthcare workers. I think someone gave an example in the comments that in some communities they do not even have primary healthcare centers. The last thing that we would want in such places is for there to be more healthcare associated infections. We do not want healthcare workers to be put on the sidelines. And so all of that contributes to building up the issues around, it contributes to having more economic burden as a result of AMR. Another area to consider is also in looking at AMR and universal health coverage. It definitely undermines the progress towards that because it increases the healthcare cost for the country. It reduces the effectiveness of essential services. It puts essential workers out of their jobs because of infections. Overall, it's more people would face really high out-of-pocket expenses for their health, and overall, we have leading to ineffective antibiotics and prolonged illnesses. All of these as a whole contributes towards just having economic and financial burdens on the individual, on communities, on the corporate world, on countries as a whole. And that would point to why it's so important for us to address AMR. And then we can also look at cross-sector collaboration in AMR containment. What the One Health approach, again, it cannot be overstated in how the One Health approach can help us to achieve these and help us to serve as a framework to adapt and to build programs that are more suited to different communities or different countries and different cultures and different backgrounds. One thing that cross-sector collaboration can help us to do um, is to manage the spread of AMR across these different sectors. It can help us to manage misuse in human healthcare, in livestock production, in how we in waste management, and how we ensure that the build-up of all of these things are not accelerated, that we're able to we're able to integrate and coordinate action between all of these different sectors. Uh, in the human sector, we want to ensure that we implement AMS programs, we want to implement IPC programs, we want to strengthen surveillance in hospitals and clinics. We want to educate healthcare workers and the public on being rational in their use of antibiotics. And then we look at the health and human sector where we want to regulate and reduce antibiotic use in livestock. We want there to be less use of antibiotics for growth promotion. We want to promote vaccination and biosecurity measures. We want to monitor and report AMR in animal pathogens, because again, these are the animals that we eat, and that can easily jump species and become a human problem. We want to encourage good farming practices that can minimize infections, and in turn in the use of antimicrobials. Similarly, in the environmental sector, we want to control antimicrobial pollution from pharmaceutical manufacturing, from healthcare waste, from agricultural runoff. We want to be able to implement environmental surveillance to track AMR in water, in soil, and wildlife ecosystems. And these are all strategies that we can implement through the use of policy. We can set policies in place that are able to better manage cross-sectoral collaboration. And in looking at I don't want us to, again, whenever I talk about policy, I always have that concern that people think of policy as something that only exists at a very high level. Not necessarily. More often than not, all we need is for all of these different sectors to come together, to sit down together, develop their tools together to ensure that the policies that are being developed are integrated and they are implementable across all of these different sectors. We also want to ensure that there is cross-sector accountability. We can do that through things like having policies around data sharing between sectors. For example, we want those who work within the space of animal health to be able to report incidences of pathogens that are new pathogens that are showing up in animals. And we want the health systems, the human health system, to be able to pick up on that as soon as it occurs and be able to take action to mitigate the spread of that pathogen from the animal sector, the animal health sector, into the human health sector. So that is a way that multi-sectoral collaboration can work through the use of governance and policy. Okay. If I had a few examples of some systems that are implementing this effectively. I'm not sure we have the time, but what we can do is perhaps we can share some of those materials. That is the ones that have the Vietnam's National Action Plan, the US, their National Action Plan, and even Nigeria's National Action Plan, because I think that all of these three different AMR action plans, they have effectively shown how we can adapt the One Health approach in ensuring effective multi-sectoral collaboration. The other aspects that we have also looked about, that we have also mentioned briefly, is in data-driven decision making and how that can improve accountability. I'm not going to go into that again because we have mentioned that in detail. And then also as well in strengthening the workforce capacity, in ensuring that there are addressing shortages of trained personnel across microbiology, epidemiology, ensuring that people have the right capacity and so the stewardship programs are not undermined. A good example would be in Vietnam. Part of their action plan was to invest in training hospital staff on AMS and IPC, and that improved prescribing practices. And Nigeria also has something quite similar for workforce training, but implementation has been a challenge. And this will go back to the example that I gave in looking at how Vietnam has been effective in building more capacity for AMR initiatives. There's evidence that training hospital staff on AMS and IPC has improved prescribing practices. And so these are things that we can also emulate in ensuring that not just hospital staff, but in Nigeria, where we know that the chemist is prescribing antibiotics, we know that the old person with a bicycle that is driving through communities is also prescribing antibiotics. While we don't want that to be the case, unfortunately, is the reality. And so, but what we can do is build their capacity and ensure that they are well trained to improve their prescribing practices rather than eliminating this resource for so many communities. Other strategic actions that can be implemented to ensure effective AMR programs would be in institutionalizing trainings and capacity building as part of continuous professional development programs, in rolling out e-learning platforms in the use of digital health to promote AMR awareness and stewardship, and in little things like having incentives to retain skilled professionals in public health laboratories, in those in clinical settings, and being able to ensure that the right capacity is available across all the different levels. And one other thing too that I would include that is not necessarily here in how policy can address the issue of AMR would be in ensuring that the healthcare systems have the right tools, have the right structures, again, from surveillance, from the laboratory to IPC measures. We want to ensure that everybody has the right tools, even if it's just in the reporting tools, that the reporting tools are readily available. You'll be surprised at how very little intervention, very little can make a very big difference. Something as simple as having a tool that is standardized across all levels. So in a way that what is being reported at the facility level is in line with what is being reported at the local government level, is in line with what is being reported at the state level, and what gets to the national level. When all of those things are working together in tandem, it's much easier to take action. It's much easier to be harmonized in the way we work and not exist in silos. I will stop talking. I feel like I've spoken so much. I'll stop talking at this point and give people some time to ask some questions before I round up with the session. I know that I have spoken a lot and provided so much information. I'll give some time to ask questions and I'll answer them as best as I can.
Yeah, please, everyone, feel free to ask questions. That is why our facilitator is here. In case you have anything you need clarifications on, please feel free to ask. So I can also start first. I have a question. So when it comes to, I just want to be sure, like, what exactly is the main reason why? Because one of the main drivers of AMR in LMICs is this easy access to antibiotics over the counter. Like anybody can just go and purchase antibiotics from any local pharmacy. Either is a good antibiotics, either is a fake one, either is, do you understand? So there's really no regulation. But in developed countries, there's this regulation. You can't just walk to any pharmacy and purchase antibiotics. So what exactly is that policy that can be implemented, or why has it not been implemented when we all know that this is also a major driver of antibiotics resistance? Like, so I just keep wondering, like, why hasn't this policy been implemented in countries like Nigeria, in countries like Ghana and some other countries that are facing the highest burden of AMR? Is it a policy issue? And if so, what exactly can be done to enforce this? Thank you.
All right. Thank you for the question, Taiwo. Christina, you have your hand up, so I'll let you ask your question as well before I respond to both.
Okay, my own is not a question per se, but maybe an observation actually. I want to say, based on my research and observation in the past few months or years, I'll say our major problem in Nigeria is not policy. It's more systemic one and structure. For example, if we want to start making policies now around AMR, we'll say, okay, people should not buy over the antibiotics over the counter. Okay, so how do we now make it available to them? For example, for someone like me that is from a village now, we do not have a primary healthcare center. So it means the major part of our healthcare services are obtained through over the counter, and maybe all these pharmacy that can treat us, give us injections. It contributes to all these things. So I think the major thing for now, the first step is not, coming up, formulating policies first. It's about fixing the structures systemically from the granular level before we can now start talking about policy, because policy cannot be effective without structure. Behind every policy that is functioning is a structure that is making it to be functioning and effective. So that is just what I want to add to it. Thank you.
Thank you so much, Christina. That was excellent. I think that was a very wonderful contribution, and I think you even helped me to respond to answer some of Taiwo's questions. Well, I'll speak further on it. Let Shitu, you have your hand raised, so I'll let you go.
Good afternoon, ma'am.
Hi, good afternoon.
Thank you very much for the presentation. My question is, during your talk, can you hear me, sir?
Yes, please go ahead.
Okay, during your talk, you made mention of something like in a village where elderly do ride on bicycles to sell drugs, and you said the ways we should be thinking is how to license them. So because most of the chemists we have that are selling these antimicrobial drugs at the counter, they are licensed, some of them, and they still sell out without prescription. So, and definitely the pharmacist or the chemist store keeper don't have the facility to conduct tests. So most of them do still sell out. So giving them these licenses, how will it help to combat?
Okay, thank you for your question, Shitu. You've raised excellent question, and I'll respond to all of them as a whole, because I think that they're all very linked, and also even in going back to what Christina has said. A good example is in the US, like Taiwo has said. In most countries that are so-called developed, drugs are only sold by pharmacists. You don't find people who are not licensed pharmacists selling drugs. And the profession itself is something that is well respected. And so even the pharmacists themselves do not want to do things that put them at risk of losing their licenses and things along that line. That is one huge distinction between what goes on when it comes to drug purchase in a country like Nigeria and in a place like the US or in Europe or different places where for a lot of the drugs, including especially antibiotics, prescriptions are actually required. Now, going back to the Nigerian setting, again, Christina answered Taiwo's question perfectly. The issue is not necessarily policy per se, because the truth is that these policies exist in Nigeria. Even Shitu has mentioned that PPMVs and chemists, they all have licenses to practice, because that license comes as a result of having a policy in place that requires them to have the license to practice. The next question so I think that the pushback I would have is that, or the pushback I would have towards the licensing body. Please, can you mute if you're not talking? Thank you. The pushback that I'll have towards the licensing bodies is that what are the requirements of the licensing? What are the what do people need to do to retain their licensing? What is the requirement per se? How is it implemented? How is it followed up? But even all of that doesn't matter, because I think that for the most part, a lot of us here are Nigerians, and let's be real, even when policies are in place, people still do whatever the heck they want to do. The average chemist doesn't care. When someone from the local government comes by to check on the license, usually what they do is just look at where it's posted up on the door or something, and that tends to suffice. That is usually enough. Even when you offer trainings to people, the likelihood that they, not necessarily that they listen to the training or that they care about the training, because they do care. I don't want to assume that people do not care. The likelihood that they implement the things you say in lieu of not making sales that likelihood is very, very low. The average person, the average business person just wants to make sales and go about their business. But I think that one thing to keep in mind, or one thing that has guided me personally when it comes to public health, is that you can never eradicate anything overnight. You cannot end anything overnight. And that's why when it comes to public health, we have targets. We have, you hear things like the 80-20 plan, you hear things like the 90-90-90 plan, where there are always targets. What we always aim to do is to reduce. The more we reduce the incidence of negative things, we would eventually get to a point where we eradicate it. We're never going to eradicate anything overnight. And so it means that we start small. We start with awareness, with raising awareness and being able to talk to people and educate people. If you educate a class of 1,000 people, I promise you that 1,000 people are not going to listen to what you have to say. 1,000 people are not going to take what you have to say. But if only one person takes away something, that is one less person that has that problem. I hope that makes sense. This might not be the response that you want to hear. This is probably not going to be the response that somebody from the ministry or from Nigeria CDC who is working in the space of AMR is going to give you, but this is my own realistic response, that you're not always going to get the impact that you want, but you have to start from somewhere. And so that's why we say you educate people. The more when you educate the average chemist that is selling the drugs, that they too can also educate the person that comes in to buy the drug. One basic example where people make mistakes, and I would give this example as a mistake because, well, guess what? The person in charge of the US healthcare system also made the same mistake. So it's not a new mistake. I would not be surprised if Papa Agnes in one village or one community in Osun State makes that mistake. If the person who is heading the US healthcare system can make the mistake. And that is the mistake in thinking that you can use antibiotics to treat viral infections. These are very basic things that can reduce drastically how much people take antibiotics if they have that basic understanding. So again, the goal is not necessarily to eradicate something overnight, but to take realistic steps towards reducing it. To go back to what Christiana has said, the problem is not in building policies or raising policies or all of that, but rather it's in the supportive structures and supportive systems that are in place to ensure that that policy is working. So we can set policies for people to prescribe less, but we also have to monitor how they prescribe. We have to put in place reporting systems that ensure that there is a way to monitor these things. We have to ensure that we have the capacity to be able to actually monitor these things, that we have the people on the ground, there's enough human capacity, workforce capacity, and all of this goes back to, well, is there available funding for it? So there are so many gaps and so many issues, and that's why all we can do, to be honest, is to continue to advocate, to continue to raise awareness, advocate at different levels, advocate to your government, advocate to your local government leadership, that some amount of money needs to go towards this area. It needs to go towards how we want to regulate AMR, antimicrobial use. It needs to go towards how we want to monitor the use of these things. So at the end of it, that is all that we can do, and take marginal steps towards reducing AMR occurrence, and then we can hope that we eventually get to the point where it's eradicated. I hope I answered your question.
Oh, yes, you did. So it also all boils down to this health system strengthening, because I can remember there was one of webinar, I can't remember which exactly the webinar was, but someone was saying that, oh, for instance, if someone, maybe a person that is low income, is sick, and the person knows that the amount of money they're going to spend, or even the stress involved in going to the hospital, to do the tests that are necessary for a doctor to prescribe the right medication, it's going to be costly, timely intensive, and all of that. They would prefer to just rather go to a nearby pharmacy and, just get any drug. So the issue of affordable healthcare and healthcare strengthening is also very paramount, because if people can afford healthcare, then they would see the need to go to the hospital, visit the doctor,